Fear surrounding the Ebola virus has taken root, and the timing couldn't be worse with flu season now upon us. But how do healthcare workers differentiate between patients with symptoms of the flu and those with a possible case of Ebola? News Channel's host Candace Cole is investigating the fine line between those viruses. Candace?
Well, Byron, initial symptoms of Ebola are very similar to the flu. However, officials with the Mississippi State Department of Health say that if you haven't been to one of the affected countries, the risk is low that you will be infected with Ebola.
It is indeed a scary time as the world figures out how to battle Ebola, a disease that's killed thousands in West Africa and has now shown up in the U.S., Spain, and Germany.
I'm very concerned, due to, it's coming over into our country now, and, we have kids and other loved ones.
According to the Centers for Disease Control, early Ebola symptoms mirror those of the flu, with the #1 telltale sign fever, along with muscle pains, diarrhea, and vomiting. These symptoms have given rise to public concern ever since Thomas Duncan, who died from the disease, was initially turned away from a Dallas hospital after visiting Liberia. State epidemiologist Dr. Thomas Dobbs says while Ebola symptoms are nonspecific, there's really no need to worry unless you've been exposed.
We've had a lot of near panic for no good reason. The key issue is exposure. So if you live in Mississippi, unless you have personally yourself visited Guinea, Sierra Leone, or Liberia, and been in contact with an Ebola case, you're not at risk.
To quell fears about the disease, Dr. Dobbs wants to assure Mississippians that Ebola is not like catching measles or smallpox. Rather, the real issue is that if contracted, Ebola can be deadly.
Ebola is not as infectious as people think. On average, 2 people get infected from each Ebola case. And we're talking about family members, healthcare workers, everything.
But what about smaller health clinics? How would those facilities handle an Ebola case? Local family health practitioner Dr. Timothy Quinn says his office stays prepared by asking the right questions and staying vigilant.
We have a protocol where we contact UMC and we'll call 911 to send an ambulance that is prepared to isolate that person immediately.
Dr. Dobbs says people around this time of year should be more concerned about catching the flu. However, if someone is infected with Ebola, treatment comes down to early identification and supportive care.
The main thing to do is keep people alive so that their body can recover. Ebola is scary, but flu kills us.
And just some quick facts here. While Ebola has certainly claimed thousands of lives since this most recent outbreak, looking back 96 years ago, the Spanish flu pandemic of 1918 took the lives of 50 million people, 675,000 of those here in the U.S. Live in the studio, Candace Cole, WJTV News investigates.